Filariasis, also known as elephantiasis, is a serious health concern. It is a neglected tropical disease. This means it affects poor areas and doesn't get much attention. Millions of people around the world suffer from it. This disease is caused by parasitic worms. These worms are thread-like and called filariae. They live inside the human body. Filariasis spreads through mosquito bites. When an infected mosquito bites, the worms enter the body. They grow and live in the lymphatic system. This system is like the drainage system of our body. It removes waste and keeps fluids balanced. When these worms block the system, it leads to swelling. This is a key feature of filariasis. Filariasis is a big problem, especially in tropical and subtropical regions. The World Health Organization says millions are at risk. They are working hard to eliminate this disease. Understanding filariasis is the first step to fighting it. We need to increase awareness and support control programs. This will help us protect communities from this debilitating disease. There are different types of filariasis. Each type depends on the worm involved. The most common type is lymphatic filariasis. It affects the lymphatic system, causing swelling in the legs, arms, and other body parts. This type is caused by worms like Wuchereria bancrofti and Brugia malayi. Another type is subcutaneous filariasis. Here the worms live just under the skin. They cause nodules and itching. Loa loa, Onchocerca volvulus, and Manzanella streptoturca are some worms responsible for this type. It can lead to skin problems and disfigurement. Lastly, we have serous cavity filariasis. This type is less common. It affects the lining of the abdomen and other internal cavities. Manzanella perstans and Manzanella ozardi are the main culprits. This type can cause abdominal pain and other complications. Filariasis spreads through the bite of an infected mosquito. These mosquitoes act as carriers, known as vectors. When a mosquito bites an infected person, it takes in microscopic larvae along with the blood. These larvae develop inside the mosquito. When the mosquito bites another person, it transmits these larvae into the bloodstream. Climate change is a growing concern. It affects mosquito populations. Warmer temperatures and changes in rainfall can increase mosquito breeding and survival. This might lead to a wider spread of filariasis. Controlling mosquito populations is crucial in preventing transmission. Section 4. Symptoms and effects of filariasis. Many people with filariasis don't show any symptoms initially. They are carriers of the disease. However, the worms continue to damage the lymphatic system silently. Over time, this can lead to chronic conditions. One of the most visible signs is lymphedema. It causes swelling in the affected area, usually the legs or arms. As the condition progresses, the affected area may become enlarged and hardened. This is known as elephantiasis. The skin thickens and the condition becomes irreversible. Elephantiasis can be extremely debilitating, affecting mobility and causing social stigma. Another common effect is hydrocele. This occurs when the worms affect the scrotum, leading to fluid accumulation and swelling. Hydrocele can be painful and disfiguring. Section 5. Diagnosis and management of filariasis. Diagnosing filariasis involves a simple blood test. This test detects the presence of microfilaria, the larval stage of the worms, in the blood. Early detection is essential for effective treatment. Treatment typically involves antiparasitic medications. Medications like diethylcarbamazine, or DEC, and ivermectin are effective in killing the microfilariae. However, these medications may not kill the adult worms. Therefore, repeated treatments are often necessary. While there is no cure for the chronic changes caused by filariasis, supportive care is crucial. Managing lymphoedema involves techniques like elevation, compression therapy, and exercises. These help in reducing swelling and improving lymph flow. Surgery may be considered in severe cases to improve drainage or remove affected tissues.